Stephanie Washington with the Missouri Department of Health and Senior Services Bureau of HIV, STD, and Hepatitis. I'm here to talk to you today about a very serious issue that is affecting our young people today, HIV and STDs, or sexually transmitted diseases. So let's get into it. So there's two types of STDs. There's bacterial and there's viral. You all have probably heard of these common terms if you've been to the doctor's office for anything like the colds or the flu or even food poisoning. So a bacterial infection is an infection that can be treated and cured. Say if someone slips up, they get a bacterial STD, that means that they can go to a healthcare provider, get tested, get the specific medications for that infection, and get cured. So what do you think a viral infection means? Exactly. A viral infection means that the infection can be treated but not cured. So say someone, again, has an accident and gets a viral STD, they can still go to a healthcare provider and get medications to treat the infection, but the virus that actually caused the infection will more than likely remain in the body for life. And it's important to know that both bacterial and viral infections, if left untreated, can cause other health problems, such as infertility or sterility. And that means a guy or a girl could be unable to produce children. Untreated STDs can also leave the body open to more serious infections like HIV, the virus that causes AIDS. So let's start talking about the bacterial infections first. What do we say bacterial means? Exactly. That means that the infection can be treated and cured by a healthcare provider. So first we're going to start out by talking about chlamydia. Chlamydia is known as the silent disease because often there are no signs and no symptoms. Chlamydia is one of the most common sexually transmitted infections reported in the United States. So how is chlamydia spread from one person to another? Chlamydia is spread during unprotected oral, vaginal, and anal sex with an infected partner. Key word being infected. So if this person doesn't have an STD, and this person doesn't have an STD, and they get together and have sex, they're not going to magically create one. One person has to be infected with an STD in order to pass it to another person. So again, we know that chlamydia is spread during unprotected oral, vaginal, and anal sex with an infected partner. So what are the signs and symptoms? I'm glad you asked. A lot of you think that, oh, well, I don't have anything going on, that means I'm okay. Well, that may not be true if a person has been sexually active, whether it's oral, vaginal, or anal sex. A lot of times, chlamydia will produce no signs or symptoms. That's why it's called the silent disease. But if a person does experience symptoms, a girl would have an abnormal discharge, and she could also have a burning sensation during urination. So that means that it may hurt when she pees. For a guy, it's going to be similar symptoms. Again, that burning sensation during urination and discharge from the penis. Not so common, a guy could also have painful or swollen testicles, but mainly it's going to be, again, the burning sensation during urination and the discharge from the penis. So how can this infection be prevented? Well, it can be prevented through abstinence. Abstinence is the only 100% best method to protect yourself from getting infected with something like chlamydia or any other STD, including HIV, the virus that causes AIDS. Should a young person choose to be sexually active, then it's best to use a latex condom each and every time they have sex. This includes oral sex, vaginal sex, as well as anal sex. So let's talk about some more STDs. Gonorrhea, have you heard of this one? Gonorrhea is another sexually transmitted disease that's caused by a bacteria. So again, we know it can be treated and cured. So what are the signs and symptoms of gonorrhea? Well, gonorrhea is a lot like chlamydia. It's passed the same way, it has similar symptoms, and it can be prevented the same way. So some signs and symptoms for gonorrhea. For a girl, again, usually she won't have symptoms, especially not right off. But if she does start to have symptoms, she would again suffer that abnormal vaginal discharge, and this time the discharge could be a yellowish or greenish color. A girl would also experience bleeding between periods, so that means that she might bleed when it's not that time of the month for her. And she could also suffer, again, that painful sensation during urination. For guys, again, it's going to be pretty much the same thing. A guy would experience the abnormal discharge, again, a yellowish or greenish color, pain during urination, and also this time he might suffer from swollen or sore testicles. So what are the modes of transmission for gonorrhea? So again, just like chlamydia, gonorrhea is spread during unprotected oral, vaginal, or anal sex with an infected partner. Gonorrhea is extremely contagious, and it can also be passed to the throat and to the eyes. So how can gonorrhea be prevented? Again, we know that abstinence is the best method to protect yourself against becoming infected with gonorrhea and every other STD, including HIV. If a person does choose to be sexually active, the best method for protecting themselves would be to use a latex condom correctly and consistently each and every time they have sex. So now we're going to talk about syphilis. And I really want to focus on syphilis because it's a very serious infection. It can even kill a person. So syphilis is called the great imitator. And it's called that because a lot of the symptoms that syphilis produces mimic symptoms of other health problems. For example, one of the main symptoms of syphilis is skin rashes. Well, it's common knowledge that if your mom does something like switch laundry detergents, that could cause you to break out into a skin rash. Or even if you eat something that you're allergic to, you could break out into a skin rash. So this is just an example of why syphilis is called the great imitator. So let's talk a little bit more about it. So how is syphilis passed from one person to another? Well, syphilis is passed differently than the other infections that we've talked about. When a person first becomes infected with syphilis, they will develop what is known as a syphilis sore. This sore is small, round, and painless. Sometimes it's red, and it's located on the body wherever the infection entered the body. So for example, if a person was having oral sex with someone that had syphilis and had that syphilis sore, where do you think that sore would appear? Exactly, in the mouth. So in order for one person to pass syphilis to another person, that person has to come into direct contact with that syphilis sore. And usually this takes place during oral, vaginal, or anal sex with an infected person. So what are some of the signs and symptoms of syphilis? Well, syphilis is a very complicated infection. In fact, it has 3 stages that it progresses through before it can ultimately kill a person. Those stages are known as the primary stage, the secondary stage, and the late or latent stage. Usually a healthcare provider can tell which stage of infection a person is in by the symptoms they're having. So let's talk about the primary stage first. For the primary stage, a person will just have that one syphilis sore that we just discussed. Remember, that sore is small, round, and painless, and it's located on the body wherever the infection entered the body. So this sore will last for several weeks, and it'll go away with or without treatment. If the sore goes away without treatment, it doesn't mean that syphilis magically is gone. It just means that the infection is continuing to get worse and progress to the next stage, which is the secondary stage. For the secondary stage, the sore goes away, but then a whole other set of symptoms starts to take place. A person can suffer from muscle and joint pain. A person can suffer from a condition called alopecia, and that's where the hair can fall out in clumps and patches. And the classic symptoms for the secondary stage are skin rashes, usually located on the palms of the hand and the soles of the feet. Now again, these symptoms will go away with or without treatment. And again, if the symptoms go away without treatment, it doesn't mean that syphilis is gone. It just means that it's continuing to progress and get worse and move to the last stage, which is the late or latent stage. For the late stage, this is when syphilis starts to cause internal damage to a person's organs. These internal organs include the brain, the eyes, the bones, the joints, the heart, and the liver. So basically, these internal organs start to deteriorate. A person can start to suffer from gradual blindness where they can't see anymore. A person can start to suffer from dementia, which is basically where they go crazy. And the end result can be death. Now, it can take anywhere from 10 to 30 years for a person to die from syphilis, but if they aren't going to a healthcare provider, getting tested, overlooking these symptoms and thinking that it's just something else, it can easily get to that point. It's also important for us to learn about syphilis because a syphilis infection can be fatal in an unborn child. If a mother gets pregnant and becomes infected with syphilis and doesn't get treated, then she runs a very high risk of passing that syphilis infection on to her unborn child and runs a very high risk of giving birth to a stillborn, which is a baby that's born dead, or giving birth to a baby that dies very shortly after being born. So syphilis is a very serious infection. So how can syphilis be prevented? Again, we know that the 100% best method to protect ourselves is by practicing abstinence. And abstinence includes having no oral sex, no vaginal sex, no anal sex, and not engaging in alcohol use or drug use. Again, if a person does choose to be sexually active, then using a latex condom will greatly reduce the risk of becoming infected. It's also important for us to remember that condoms may not cover all areas of the body that could be infected with the syphilis sore. So though a condom will greatly reduce the risk, we need to keep this thought in mind. Now we're going to talk about the viral infections. What do we say viral means? Correct. An STD that can be treated but not cured. So first we'll start out by talking about HPV. You may have heard of this infection. It's the infection that has the vaccine out that's available for both guys and girls. So let's talk a little bit more about it. So what is HPV? HPV stands for human papilloma virus. So how is HPV passed from one person to another? Well, HPV is another different infection, so it's passed differently than the others that we've talked about. HPV is a virus that lives in the skin on or around the genital area. So in order for one person to infect another, they don't necessarily have to have sex. Their genitals just have to touch. So that would mean there has to be a genital skin-to-skin contact. So again, we know that this virus lives in the skin on or around the genitals. So in order for one person to pass it to another, they just have to have that sexual genital skin-to-skin contact. So what are some of the signs and symptoms of HPV? Well, HPV is a little tricky. There's two types of HPV. There's high risk and there's low risk. High risk types of HPV can cause certain types of cancer. And these types of cancer include cervical cancer, cancer of the penis, cancer of the anus, cancer of the vagina, cancer of the head, neck, and throat. Low-risk types of HPV can cause either no symptoms or can cause genital warts. So those will be the symptoms. For high-risk HPV, those specific types of cancer we talked about, and for low-risk HPV, either no symptoms or genital warts. So how can HPV be prevented? Again, we know all about abstinence and how it's the best method to protect ourselves. We also know that condoms do greatly reduce the risk of becoming infected with an STD. But like we just mentioned, condoms may not cover all areas of the body that can be affected. So let's talk some more about herpes. So how is herpes passed from one person to another? Well, just like we talked about HPV being a virus that lives in the skin on or around the genital area, herpes is another virus that lives in that same place. So in order for one person to pass herpes to another person, again, there just has to be that sexual genital skin-to-skin contact. So what are the signs and symptoms of herpes? Well, a lot of people think that if a person has herpes, then they'll automatically have herpes outbreaks. Well, that's not necessarily true. In fact, a lot of people have the virus and go an entire lifetime without ever experiencing symptoms. But that doesn't mean that they can't pass on herpes to another person, and that person might show symptoms. If a person does experience symptoms, then they could suffer from anything between fever, sore throat, and flu-like symptoms, which are sometimes the initial symptoms, and sometimes the first and only symptoms. If a person goes on to experience physical symptoms, then of course they would experience blisters and sores on or around the genital area. So how can herpes be prevented? Herpes, again, can be prevented 100% through the practice of abstinence. Remember, we said abstinence includes no oral sex, no vaginal sex, and no anal sex, as well as no alcohol use and no drug use. If a person does choose to be sexually active, again, a condom will help reduce the risk of becoming infected. But again, we know that a condom cannot cover all areas of the body that could be infected with herpes. So now we're going to talk about our last infection for the day, HIV/AIDS. Pretty much everyone has heard of this infection, but if you haven't, now we're going to learn about it. So just a couple of facts about HIV. HIV is the virus that causes AIDS, and there is no cure for HIV. So HIV is passed through 4 body fluids, and those body fluids are blood from an infected person, vaginal fluids from an infected woman, semen from an infected man, and breast milk from an infected woman. So normally, if a person were to become infected with HIV, they would come into contact with these body fluids during unprotected oral, vaginal, or anal sex with an infected partner, or if a person is using needles or razors or any item that could be contaminated with blood from an infected person. So basically, if you're not having sex with someone that has HIV, and you're not using needles or razors or any items that could be contaminated with blood from someone with HIV, then you're more than likely not going to get the virus. So what are some of the signs and symptoms? Well, it really depends on a person's immune system. Each HIV case is different, and one person could suffer different symptoms, and another person could suffer no symptoms at all. But let's talk about the most common symptoms. Most people with HIV could suffer from depression, weight loss, flu-like symptoms or headaches, diarrhea, night sweats, and things of that nature. A lot of people don't experience symptoms, especially after they first become infected. In fact, it can take a person years to experience any symptoms at all, and the only way to know that they would be infected would be to get tested. So how can HIV be prevented? Again, and lastly, we know that the best method to protect ourselves is to be abstinent. But again, if we do choose to be sexually active, then a condom will greatly help reduce the risk of becoming infected with things like HIV, the virus that causes AIDS. Okay guys, so today we talked about some really serious topics, things that can affect our young people. Today we learned about the most important STDs. We learned all about how they are transmitted, which means how they are passed from one person to another. We learned their signs and symptoms, which are what a person could experience if they were to become infected with an STD or HIV. And we also learned how to prevent these STDs. That means how to keep ourselves safe and healthy. We know that abstinence is the 100% best method to protect ourselves from becoming infected with an STD or HIV or both. And we know that if a person does choose to be sexually active, a condom will greatly help reduce the risk of becoming infected. To learn more about sexually transmitted diseases and HIV, I recommend that you visit the CDC's website. CDC stands for Centers for Disease Control and Prevention, and you can visit them at www.cdc.gov. Thanks so much, guys. Be safe.